So, regarding bone marrow transplantation, there is a common whenever we came across bone marrow transplantation, we have tested individual on HLA matching, HLA mismatch or HLA matching. So HLA matching is much important in transplant rejections and transplant rejections in treating a very genetic condition, congenital ones, and cancer. And in bone marrow transplantation, we did HLA matching, and HLA in a patient having genes from father and if we draw a 2 by 2 uh, table, we see there is a chance of 25%, 25%, and then 50% chance. So there's a 50% chances of haploid identical, like a patient, a father and a mother having 4 siblings, and in these 4 siblings there is a 25% of chances of HLA mismatch and 25% chances of identical match, but there is a 50% chance of haploid identical. Haploid mean they have the half alleles. Haploid identical. So we have to remember these three sentences: 25% mismatch, 25% match, and 50% of haploid identicalism. And then we have for congenital genetic conditions. For congenital genetic condition, we always use autologous matched unrelated donor. This sentence is very common in the answer choices, and we have to pick whenever there is a congenital problem like aplastic anemia, etc. So matched unrelated autologous donor, what is this? And we will discuss in the bone marrow transplantation. In the transplantation, we have donors like there is an allogenic. This is allogenic. Sorry, that's my mistake. Also, there is an autologous transplantation or donors. Autologous donor mean auto means self. So the patient is suffering from any blood cancer and its bone marrow is producing default T cells. Then it has some cells of cord cells, or like it has some say he saved some of his cell in from the infancy, and he wants to use those cells. So that will be the autologous category of donation, and these cells goes to the bone marrow and reproduce the cells, and normal cell reproduce a normal cell, like if a patient is suffering from any kind of illness. So this is autologous donor, and it is not useful in any in correcting any genetic condition because the defect is same in the gene of the stored chromosome as well as in the bone marrow. So after autologous donor, it is not useful in congenital genetic condition. So after autologous, we have the Syn mean synchronize, or syn mean having same. Syn genetic donors. Syn genetic donors mean like identical siblings. So the identical siblings, they do not cure any congenital genetic condition. Rather, they can cause another mutation. Like if a mutation is present in an identical brother or sister, then it can goes to the patient and it can produce and it will suffer from another condition. So syn genetic donors mean identical siblings, and they are not treating the congenital condition. Then we have the autologous allogenetic donors, and in allogenetic donors we have the related ones, and then we have the unrelated ones. So in the allogenetic mean they have the same genetic, like species to species. Like a man is donating his blood to another for another man, or a human to human, and monkey to monkey, and then so allo mean in between the same species. And these donors are maybe relatives or non-relatives. So there is a allogenetic same genetics donor, related and non-related. So in related we have the related non-identical siblings, and these non-identical related allogenic donors non-identical sibling has the chances of rejection, have the chances of matching, have the chances of mismatching or rejection. Mismatching, first discuss mismatching, of 25% and 75% of matching chance, like we have discussed here. 25%, in this 50 there is a 25% of matching rate. And then we have unrelated. So allogenetic, same species, and these are donor, but these are unrelated. So unrelated mean they have different genome, they have different HLA genes, they have different genes, HLA B, A, B, C, D, Q, R. So they have normal or non-diseased HLA gene, and they are curable. They are best for congenital genetic conditions. So that's why we always use congenital genetic condition, we always use allogenic matched unrelated donors. So there is a two MCQs over here. First one is this one, and second one is this one. So we have to understand this table, the 2 by 2 table, and this ratio, and also which donor is used in bone marrow transplantation. So this is all about bone marrow transplantation. We have discussed HLA, we have discussed innate and adaptive immunity, we have discussed the bone marrow transplantation, and that's it.